section with the member from Courtenay-Alberni.
Thank you, Mr. Speaker, and it's a pleasure to be joining you from the unceded lands of the Sishat and Hupachesit people in Port Alberni on Vancouver Island in Nuu-chah-nulth Territory. We continue to hear the Liberal government talk about the toxic drug crisis as a public health issue, not a criminal justice issue. Will the minister tell us, does he agree that it is a public health issue, or is it a criminal justice issue in his eyes?
The Honourable Minister has 24 seconds on the clock.
I think with respect to the opioid crisis and the narcotic situation that British Columbia is facing is that we've adopted an approach that it needs to be treated as a health issue, and we've adopted policies of harm reduction since 2015 and will continue to do so.
The Honourable Member from Courtenay-Alberni.
Why is the Liberal government making it a criminal issue east of the Rockies for the rest of the country, if that is the position of government?
The Honourable Minister has 7 seconds.
So this issue has been dealt with as a healthcare issue since the start, and we've adopted that posture in terms of many of our policies, including responding to the very direct ask by the BC government to pursue decriminalisation.
The Honourable Member from Courtenay-Alberni.
What evidence does the minister have in terms of public safety concerns linked to simple drug possession?
The Honourable Minister of Justice.
Many of these questions would perhaps be better put to the Minister of Mental Health and Addictions or the Minister of Health, but what I can say is that we've analysed the evidence that we have in terms of responding to direct asks for decriminalisation.
The Honourable Member from Courtenay-Alberni.
Okay, these are justice issues, Mr. Speaker, and they're justice issues for every member of Parliament. So he can also answer his position and viewpoint as a member of Parliament, just not just as a cabinet minister. How much does this government spend on policing drug offences versus investments in harm reduction and treatment and recovery?
The Honourable Minister has 15 seconds.
Well, the police of jurisdiction would be able to answer that question in terms of how much money is being spent on policing initiatives, including police of jurisdiction in localities such as Vancouver.
The Honourable Member from Courtenay-Alberni.
Now, regarding the decision to allow the recent amendment of the BC's decriminalisation pilot and the rejection of the Toronto application, despite the fact that we've seen 11% decrease in toxic drug deaths in British Columbia since the beginning, since March of 2023, and we've seen a 17% rise in toxic drug deaths in Alberta, 23% in Saskatchewan. What analysis was done to ensure the right to life, liberty, and security of the person for people at risk of dying was adequately considered? And will the minister agree that criminal law has not and will not end drug possession and use of illicit substances?
The Honourable Minister has 41 seconds on the clock.
To the member opposite is that I share his concerns about the deaths that are occurring. We're attempting to address this from a harm reduction perspective and focus on health outcomes as opposed to criminal justice outcomes. But what's really critical to understand is that the response that we've made has been at the behest or request of provinces or cities of jurisdiction. Thus far, we've had 2 such requests, one of which we've granted and then moderated when that was also requested of us, and the second one has been rejected.
The Honourable Member from Courtenay-Alberni.
Well, Mr. Speaker, if that's the case, why did this government overrule the expertise of a local board of health and the support of the Toronto Police Service and cite public safety concerns to reject Toronto's decriminalisation application?
The Honourable Minister of Justice has 13 seconds on the clock.
What I would indicate is that some of these questions might be best put at Committee of the Whole to the Minister of Health and the Minister of Mental Health and Addictions, who will be here next Wednesday in this similar format. But I would also reiterate that under C5, changes were implemented to encourage alternative responses to simple possession.
The Honourable Member from Courtenay-Alberni.
Why then is this government resorting back to failed policy, perhaps preferring political optics over saving lives?
The Honourable Minister has 4 seconds.
Reject that categorization outright. We are responding in a manner that is commensurate to the requests that are being put before us.